welcome to the Medicos update. Latest medical news from around the world. It is presented by Medicos. Anti-inflammatory effects of the omega-3 fatty acid could help reduce depression. The omega-3 polyunsaturated fatty acid, eicosanoic and the docosahexaenoic are found in the oily fish. The paper omega-3 polyunsaturated fatty acid protect against inflammation through production of the LOX and the CYP450 lipid mediators, relevant for the major depression and for the human hippocampal neurogenesis, was published today in the Molecular Psychiatry. Family history doubles asthma risk for the preschoolers. Children with a family history of the asthma have more than twofold higher rates of the asthma through age 4 years. These findings suggest that the asthma intervention developed to target every childhood may be important for the prevention of the asthma among the children with a family history of the asthma and among the black children. New biomarker may predict course of the interstitial lung disease in systemic sclerosis. Radiographic assessment of the interstitial lung disease progression and the protein from the bronchoalveolar lavage may independently provide better insight into the prognosis of the patient with the systemic sclerosis. The findings are interesting from a research perspective and potentially relevant for the clinical practice, but the utility of the measuring biomarker in the bile should be further studied for predictive value in the clinical endpoints. Novavax COVID vaccine co-administered with the flu vaccine appears safe and effective. Researchers from the UK recently reported that the result of the sub-study that evaluates the safety, efficacy, and immunogenicity of the NVX COVID 2373 vaccine when co-administered with the approved seasonal influenza vaccine. The study findings suggest that co-administration of the COVID and the flu vaccine is fairly safe and might be viable immunization strategy. Prophylactic anticoagulation tied to the lower death rate in COVID. Prophylactic use of the low-dose anticoagulation to prevent venous thromboembolism was associated with a reduced 60-day mortality and in the patient with the hospitalized COVID-19 in the state of the Michigan. The best medication choice is enoxaparin, Lovenox, which can be given once a day, and opposed to the heparin, which needs to be given via injection 3 times a day. Yeah, the references you can go on. So that's all from us in this today's update. Thank you. Stay safe. Stay healthy.